Hello, I am Dr. Rajeev Reddy, a consultant in Orthopedic Onco surgery, that is a bone cancer treatment specialist. We would like to speak about bone cancers which are common in children. Unfortunately, sarcomas or bone cancers like Ewing sarcoma and osteosarcoma are common in children and the adolescent age group. Normally, people who are adults present to us with pain and swelling. But in children, the parents notice that the child is not walking normally or walking with a limp. In the older age group, like the adolescents, the child tells the parents that they are having pain or swelling around the knee joint or in the other limb. In such a scenario, the parents usually consult a pediatrician or an orthopedician who clinically examines the child and place a request for an X-ray. Once the X-ray shows something suspicious, then they refer the patient to an oncologist like an orthopedic oncologist who evaluates the child and gets an MRI scan done. An MRI scan tells us in more detail about the tumor and the bone condition than other investigations like an X-ray. Once the MRI is viewed and if this particular problem is looking like a tumor, then the orthopedic oncologist does what is called as a biopsy. A biopsy is a keyhole biopsy, which is a very important test where the child is generally placed under anesthesia and tissue is taken to send to the pathology lab for testing. Once the biopsy report confirms that this is a bone cancer or a bone tumor, then the orthopedic oncologist sits down with the parents and discusses various treatment options with them. The treatment options would involve a wide variety of specialists from medical oncology, radiation oncology, pediatrics. The options begin with chemotherapy, where a medical oncologist gives drugs, that is intravenous drugs, so that tumor or the bone cancer shrinks, following which a limb salvage surgery is performed by the orthopedic oncologist. In most of the bone cancers or bone tumors, limb salvage, that is saving the limb surgery, is performed successfully and the child returns to normal activities with good function, provided certain conditions are met. Following the surgery, the child then receives chemotherapy again. In certain tumors like Ewing sarcoma, which are common in children, radiation is also a treatment option that is routinely used. What we should remember is that the child, when presented early to the orthopedic oncologist, returns to normal activities with good function. And it is important for the parents to understand that the follow-up is as important as the treatment, and the child should continue to follow up with the oncology team till at least about 5 years, so that we know that this disease and this war over bone cancer is won over.